Okay, good afternoon, everyone. It's 1 o'clock. We'll go ahead and get started. I'm Scott Earnest, Associate Director for Construction in NIOSH's Office of Construction Safety and Health. I'd like to welcome everyone to today's webinar on protecting construction workers and OSHA's guidance on mitigating and preventing the spread of COVID-19 in the workplace. This is the 17th webinar so far in our CPWR NIOSH COVID-19 webinar series for the construction industry. We're excited to partner with OSHA today to bring you updates on the new guidance released on January 29th, which aims to help employers and workers identify risks of being exposed to and contracted COVID-19 at work and to help determine the appropriate control measures to be implemented. Before we get started, I'll give a few updates from CDC and NIOSH, and then we'll hear from Amanda Edens, Deputy Assistant Secretary of Labor for Occupational Safety and Health. Amanda can only be online for about 20 minutes, so after she speaks, we'll pause for a quick Q&A before moving on to the rest of the panel. That includes Christina Dragon, health scientist with OSHA's Director of Technical Support and Emergency. She'll present on the new guidance, followed by remarks from Scott Ketcham, the Director of OSHA's Director of Construction, and Tim Irving, Deputy Director of DOC. We'll then open the floor for more Q&A. Chris Kane, Executive Director at CPWR, is here to lead us through some discussion. We did receive a number of advanced questions through registration, which will be addressed first, followed by live questions as time permits. Please type your questions at any time in the Q&A box, and any questions we don't get to will be used to inform future webinars. With that, we'll go ahead and get started. So as far as the CDC and NIOSH updates, there's just a few things I wanted to touch on. I wanted to discuss some of the CDC data in the data tracker. I wanted to mention a new article that came out in the last week in CDC's publication, the Morbidity and Mortality Weekly Report. And I wanted to update everybody on a few upcoming stand downs that we're partnering with stakeholders on to focus on the Focus 4 hazards. Lastly, I wanted to also mention that CDC and CPWR have a lot of resources on vaccinations that are available on their websites. So if you haven't taken a look at the CDC or the CPWR website recently, check those out for fact sheets and infographics about the vaccines and why it's important to get vaccinated. I wanted to start off with the data tracker and some good news. And the good news is that there's been a 5-week downward trend in cases. The highest 7-day moving average occurred on January 11th, 2021 of approximately 249,000 cases. But since then, there's been a 70% decline from the peak. So really good news in terms of the number of cases. And equally good news is we're making significant progress on vaccinations. The U.S. COVID-19 vaccination program began December 14th. And as of February 18th, there have been approximately 58 million vaccine doses have been administered. 41 million people have received one dose of the vaccine, and 16 million people have received 2 doses. So we're continuing to make progress. I also wanted to point out an article that was recently published in the CDC publication, Morbidity and Mortality Weekly Report. The title of this is Maximizing Fit for Cloth and Medical Procedure Masks to Improve Performance and Reduce SARS-CoV-2 transmission and exposure. CDC conducted experiments to assess 2 ways of improving the fit of medical procedure masks: fitting a cloth mask over a medical procedure mask and knotting the ear loops of a medical procedure mask and tucking in and flattening the extra material close to the face. Each modification to the mask substantially improved the source control and also reduced the exposure of the wearers. These experiments highlighted the importance of a good fit to maximize mask performance, but they also showed that using a double mask can improve particle collection and filtration efficiency. So both of those approaches are ways to improve the performance of masks. And then just to sort of wrap things up with the update, I wanted to point out a couple of stand downs that OSHA, NIOSH, CPWR, we're partnering with stakeholders on several of the Focus 4 hazards for the construction industry. We'd like to invite all of you to join with us and partners on April 26th for the 2nd annual National Stand Down Prevent Struck By Incidents. This is the first day of National Work Zone Awareness Week. The stand down is asking contractors to pause work to recognize that struck by incidents are a leading cause of death among construction workers, and to educate crews about risks and solutions for mitigating them. To make the stand down a success during COVID-19, we're encouraging contractors, workers, and other stakeholders to participate virtually. The NORA Construction Sector Council will be holding 2 webinars as part of this virtual event, and more information on how to participate virtually or how to hold your own stand down at a safe social distance will be posted on CPWR's Struck by Hazard webpage soon. I also wanted to mention and remind everybody of the National Falls Campaign stand down that's occurring in May. It will occur the first week of May. It will primarily occur online as well. The campaign to prevent falls in construction began in 2012 with construction industry stakeholders seeking a way to raise awareness. Falls from heights are a leading cause of injuries and fatalities in construction, and with those coming disproportionately from small residential construction contractors. So again, we've got 2 stand downs coming up in the next several months. We'd love for all of you to participate. They're very important in terms of reducing hazards to construction workers. And lastly, I just wanted to point out some important web links that you can check out to get more information about COVID and issues related to COVID. With that, I'll turn things over to the Deputy Assistant Secretary, Amanda Edens.
Again, thank you for the invite. I think these sessions that you all have are, really nice and critical because getting information out there is, always helpful. And I think as Scott mentioned at the end of this slide, even though this is about COVID, our work at OSHA in other areas, especially in the construction area, still goes on. We're still having, just yesterday we had a fatality trench, up in Region 1. And so, we're still keeping mindful of that as we move forward on some important initiatives, one of which Christina will go over today. I apologize that maybe some folks from Standards and Guidance who were, instrumental in this and doing some other things that you may be interested right now couldn't make the call because I think maybe if you don't know, there were several executive orders issued right after the president came on board after the inauguration, and several of those focused on OSHA. And in terms of, getting out the guidance, which you see now, looking at doing a national emphasis program on COVID and making consideration of an emergency temporary standard. And so as a consequence of those things, a lot of the people that has maybe more of the information that I have are more directly involved couldn't be here today with you. But hopefully when sort of some of that passes and they can come to one of these webinars, I think we'll get them and you can ask them lots of questions because I think a lot of people have questions in a lot of these areas. So hopefully in the future, we can get some of the subject matter experts, not that Christine is not one of them, but there's some people that are just really immersed right now in work of a potential emergency temporary standard. I think from the front office, and I'll say this, the Office of the Assistant Secretary for OSHA, this is sort of an unusual time. I think last go around, it was unusual that we never had an assistant secretary. I'd never seen that in my 35 years being with OSHA, but also in my 35 years of being with OSHA, I've never seen an administration where we're on day 1 of a new administration, we have 3 new political appointees. And that's been really great for us because it makes it a lot easier to get through some of the clearance and try to navigate through a new administration. So we're very happy to have Jim Frederick, Chip Hughes, and Ann Rosenthal, who is a former OSHA employee, at the helm of OSHA right now, guiding and in the trenches right now, working on a lot of these efforts. And these guys and gals are working, day in, day out, weekends and long nights. So hopefully you'll see some of the fruits of their hard work right now as they go to doing the important work that the president has directed OSHA to do. So that's kind of the main message that, we are, with any administration, you change focus. And obviously, I think if anybody's been reading the press and things of some of the things we've done so far, you'll see sort of the trend of change in which the new administration is going on COVID. And I think some of it is very good. And hopefully we'll be doing more of that. Obviously, like I said originally, the work of the agency, the bread and butter work of the agency, continues. Scott and Tim will probably tell you about, we're doing the stand downs, we're doing directives on things that impact construction, work with cranes, work with that's in the trenching area. So we still have a lot of important construction work that needs to get done, even if COVID wasn't around, but it is. And so we have to sort of do that work. Plus, we have to do it in a kind of a COVID environment, even though it's not really maybe some of the more areas where we're having outbreaks like meatpacking plants or hospitals. They're still with our own co-shows and probably with your workers. You're maybe in communities where COVID is there, and so we have to figure out, the best way that we protect our own staff at OSHA, plus give the right guidance and have the right rules in place to help protect, construction workers out there, because construction does make up a good proportion, in growing proportion, is often at 50 and sometimes more 50% of the work that OSHA does is in the construction area. So I think, Scott and Tim do a great job of reaching out to folks like others on this call, interacting with NIOSH, and I think we want to continue that relationship because getting that kind of input is very important, even if it's input that may seem critical. I have never shied away from critique. I think that's the only way you get better and learn. So, whatever kind of comments, even if they might be a little bit pointed, I still think they are, learning opportunities for the agency to either, redirect resources, do a course correct, or just change in total the way we do things. Can't always make everybody happy, but I do know that Jim and Chip are very much in a listening mode now. Jim is not sort of new to OSHA, but he's new being in a bureaucratic role in OSHA. Chip is also from another bureaucracy at the Department of Health and Human Services. But, OSHA is its own entity, so I think they're in sort of the learning mode. And, when most people start their first days at OSHA, they have sort of a honeymoon period where they get to learn the agency and how the Department of Labor works. And these guys have had to go from day one doing things. So I give them all the credit in the world. They hit the ground running, and I think the guidance is one of the first examples that Christina will go over in a few minutes about one of the first products that they generated within the first week of being at OSHA. So I don't think that I'll try to belabor the point anymore. I just thank you for letting me open up with a few words. And if you have some more high-level kind of questions that you'd like to ask, I'm certainly open to entertaining a few questions where I can.
All right, thanks. This is Chris Kane with CPWR. Hi, Mandy. I do have some questions that came in during the registration process. I wanted to throw a couple at you since I think you just have a couple more minutes with us.
Okay.
I'll go to the rest of the Q&A after Christina presents on the guidelines or the guidance that you put out. So the one question is kind of around temperature scans and taking workers' temperature. And the sense of the question is, it's kind of a two-part question. Do employers need to take the temperature of workers? In this question, the employer is requiring that workers take their temperature at home and then do like a report on what their temperature is. And if that's the case, do employers need to record that information?
Yeah, I think even before this administration, we've struggled a little bit, and I'll have to tell you, maybe Christina knows exactly what they say in this guidance on temperature, but we've struggled with it a bit because it's not, like a foolproof kind of thing, right? There's many different symptoms that come with COVID, and, not having a temperature doesn't mean you're not necessarily, have some other symptoms that might be important. So, not having a temperature is not like a foolproof measure, but it is one measure, right? And it's something that people can easily do. And in some ways, it's good to sort of train people to sort of monitor their own health so they don't come and then get to the building. They travel all this way, and then they go, and then you're at the door after you've traveled all the way, and they say, oh, your temperature's high, turn around. And it's sort of, it disincentivizes people, they might try to do things to sort of hide symptoms. So we try to train. I think training is a big aspect of that, and trying to get people to look at that. In some ways, I'd have to go back and check whether or not that's actually a medical record. We've gone back and forth on that as to whether that constitutes, a medical record under 1910-1020, and whether you'd have to do it. I guess it depends on the way in which you capture it to some degree, because some people are just doing it as it's a screen, you have the thermometer there, you check the temperature, and then it's kind of like it's over or it's not. You don't necessarily make it a medical record and, and put it into sort of a health thing. I think if you do that, you start to get into the medical record realm. And so just doing a screen might not necessarily be, I don't know, Christina, if you had a thought on that one, you're popped up right there.
Yeah, I thought I would chime in and just share that I'm pretty sure the determination that had been made by OMN was that it didn't constitute a medical record and employers did not need to track temperature. If they were choosing to do temperature screenings, it definitely can identify some symptomology, but it wouldn't catch asymptomatic or pre-symptomatic folks. But they do not need to keep a record of it.
Yeah. So I guess, in some ways, you try to discourage people. I think, sometimes when people create records unnecessarily, that's where they get into this thing where now they've got this record that starts to fall under things. So I think a simple screening, because you'd be wanting to screen for a lot of symptoms. But I think in my mind, essential to that is the training to the folks. These are the symptoms. If you have these kinds of things, don't come to work. And because you don't want them sort of not doing that screening, relying on something right at the door, that might be a little less effective. But, I think it's up to the employers to figure out sort of what works best with them. The whole goal is to do some sort of screening so that you can do as much as you can to screen out people who may have some symptoms. And that's why, you still have to do all the other things because the asymptomatic piece is such a big piece. So anyway, that's my 2 cents.
Great, and I'll just ask one other question, and we can punt it to Christina if you want to, but it's about return to work, and in the case of someone who's had active COVID disease and have recovered from it, this employer is asking, he doesn't have symptoms anymore, can he come back to work can this employee come back to work without a medical slip? And it's really about the timing of when a worker is allowed to come back onto the job site after they've had active disease.
Yeah, to some degree, I think we would be following sort of the CDC guidance on it. I know that they have, guidance about when you can return and when you're not. So I think I would sort of go towards, Christina, did we have anything about the sort of parameters around returning to work in our guidance?
We specifically point to CDC and following CDC's recommendations on that. They have a great website that has basically a rubric for if you are symptomatic and test positive, asymptomatic and test positive, and basically looking at when you can be safely around other people after those things.
Yeah, and obviously that's something that sort of changes as they learn more about, symptoms and as they find more, they've learned more about the disease as it has progressed. And, I think the thing that we would always tell people is, on our website, on CDC's website, some of this information changes, as they learn more about the progression of the disease, as they get more experience with seeing how people have gotten it, have recovered, and the time that it takes. And obviously that's a variable thing, it's the thing about infectious diseases. It's based on people's immune system and how they respond to it, and not everybody responds the same way. So it is a very challenging thing, and it's challenging, I think, for OSHA and CDC to give guidance because the science changes and what you learn. And it's challenging for employers too because they're trying to keep up with what we're learning as we go. So,
great. No, I agree with that. And Jessica posted in our chat a link to the returning to work guidelines from CDC. So thank you so much, Mandy. I know you have to run, and I think at this point, unless Scott Earnest disagrees, we can turn it over to Christina to begin your prepared remarks. Thanks, Mandy.
All right. Thanks, everybody. Good luck. Bye.
Thank you all so much for having me here. First, as Mandy was talking about, I'll start with discussing the executive order on protecting worker health and safety that was issued by President Biden on January 21st. Next slide. So on January 21st, President Biden issued an executive order calling for increased protections for workers as we continue to battle the pandemic. Stopping the spread and protecting workers from SARS-CoV-2, the virus that causes COVID-19, is the only way to get the economy and our lives back on track. President Biden's executive order directs OSHA to issue some revised guidance to employers on workplace safety during the pandemic, and I'll get to that next. It also asks OSHA to consider whether an emergency temporary standard on COVID-19 is necessary, and if so, to issue it by March 15th. To review OSHA's enforcement efforts related to COVID-19 and identify any changes that could better protect workers and ensure equity in enforcement. To launch a national enforcement program related to COVID-19 to focus OSHA's efforts on violations that put the largest number of workers at serious risk or are contrary to anti-retaliation principles. And to engage with labor unions, community organizations, and industries on multilingual outreach campaigns to inform workers and their representatives of their rights, placing a special emphasis on communities hit hardest by the pandemic. As part of the President's executive order, we'll also continue to coordinate with states that operate their own occupational safety and health plans, or the OSHA state plan states, to ensure that workers covered by those plans are adequately protected from COVID-19. In states without a state plan, OSHA will consult with state and local government entities to bolster protection from COVID-19 for public sector workers, and consult with other federal departments and agencies to explore ways to protect workers whose safety and health are not currently being covered, so that they too can remain healthy and safe during the pandemic. Next slide. On January 29th, OSHA took the first step towards improving protections by issuing updated guidance. This guidance is designed to help businesses decrease risk and improve worker safety so they can reopen and stay open safely. It provides a roadmap for businesses to protect the health of their workers, which must be our top priority. The biggest takeaway from this updated guidance is that implementing a COVID-19 prevention program is the most effective way to reduce the spread of the virus. Employers should implement a COVID-19 prevention program tailored specifically to their workplace and workforce. The most effective programs engage workers and their representatives in their development and include the following key elements: conducting a hazard assessment, identifying a combination of measures that will limit the spread of SARS-CoV-2 in the workplace, adopting measures to ensure the workers who are contagious or potentially contagious are excluded from the workplace, implementing protections from retaliation for workers who raise COVID-related concerns, and educating and training workers about COVID-19 policies and procedures in languages they understand. Next slide. The guidance provides additional details on key measures for limiting the spread of SARS-CoV-2, starting with separating and sending home infected or potentially infected people from the workplace, implementing physical distancing, suppressing the spread by using surgical masks or cloth face coverings, and the use of personal protective equipment. OSHA will continue to update this guidance over time to reflect developments in science, best practices, and standards, and will keep track of changes to ensure transparency. Please help us share this guidance as widely as possible within your workplaces as well as with other key stakeholders. And let us know if there are any ways that we can help you get the message out. Next slide. So you can always check for the most updated information on OSHA's website, osha.gov/coronavirus. We're doing everything that we can to reaffirm the agency's commitment to worker safety and reestablish trust that OSHA is advocating for workers, including the most vulnerable to the risks of COVID-19. OSHA will continue to work hard to assure that every worker is protected and so the nation's economy can get back to business safely. Next slide. So we received a couple of questions ahead through the registration process. And so I wanted to touch quickly on some of those. I think Scott and Mandy both alluded to them as well in the beginning. In situations where folks might be infected with SARS-CoV-2 and be asymptomatic or pre-symptomatic, they may not be showing any of the signs or symptoms that we have been looking for over the last year. That doesn't mean that they are not contagious. It just means we'd have a harder time being able to tell whether they are or not. Somebody who is asymptomatic or pre-symptomatic wouldn't show up through a temperature screening, as Mandy was indicating, but ensuring that folks wear masks or face coverings when they're in close contact or proximity to other people is a sure way to help limit the spread of even those who might be asymptomatic. Next slide. There were also some additional questions about face coverings and mask usage. Scott did a really great job mentioning earlier about the new paper that came out, talking a little bit more about face coverings and appropriate fit. CDC has really excellent resources on these topics. I believe those were dropped in the chat as well, so you can follow up with them. Obviously, if you are working on something where you would normally wear a N95 or higher level respirator, you should continue doing that for the jobs that require them. But at all other times, wearing a cloth face covering with at least 2 layers of fabric that's washable and breathable and creates a tight seal around the face is the best option for keeping yourself and others safe and healthy. Next slide. I know a lot of folks are very fond of using gaiters as well as a mask alternative. And the key issue with those is to make sure that they are 2 layers of fabric or more. If it's only a single layer, doubling it over to create a little bit more of a thicker mesh. Bandanas, scarves, and other loosely woven fabrics are not ideal. Face shields are also not considered appropriate face coverings. Next slide. And then there was a couple of questions about double masking and whether that was safe and effective to use. CDC includes a lot of really awesome pictures and information about that as well. And double masking usually refers to combining the use of a surgical or procedure mask with a cloth face covering so that one is sort of helping the other fit more snugly on the face. It's not recommended to double mask using a KN95 or N95 respirator, since that might lead to a little bit more discomfort. Also, having a flexible nose piece can help ensure a snug fit on your face mask or cloth face covering. Next slide. And then here are just a couple of additional resources. Obviously, for folks working in hot and humid conditions, it's kind of a drag to wear a face covering all the time, but OSHA has a couple of fact sheets. You can check out those links, or for both indoor and outdoor environments. I'm not sure if we have a cold season one up, but hopefully we do somewhere. I know fogging glasses is a huge issue sometimes as well. And then also some additional links to CDC. The last one there is for the return to work as well. And next slide. Ta-da, thank you.
All right, thank you, Christina. I'm going to go into some of the questions we received during the registration process, but I wanted to remind everybody who's participating live that they can type questions in the question and answer box on the WebEx platform, as well as chatting those. They're a little bit easier for us to track in the Q&A box, but either way works fine with us. So to give Christina a break, the first question I wanted to throw was for either Scott or Tim at the Director of Construction. I guess I like this question is, what kind of responsibilities do builders have in a multi-employer construction environment?
Tim, you want to take this one on?
Sure. The multi-employer worksite policy that's been around for over 20 years is still in effect and will be implemented the same during the COVID crisis with the same types of hazards, with the controlling contractor, the correcting contractor, the exposing contractor. So we will be looking at our multi-employer worksite policy for that. can you add anything to that, Scott?
Yeah, I would just say it's an important aspect because we all need to work together on this. And we all know that in the construction industry, as we have multiple trades working on a construction site for different companies, that coordination of efforts to make sure that we're looking out for one another and protecting one another is important. And not from the viewpoint of just, OSHA looking at you under the multi-employer perspective, but this controlling this disease process with coronavirus and mitigating other hazards really takes all of us working together to make sure that we mitigate hazards on the work site. Now, from an OSHA perspective, we do have our multi-employer work policy, and we will certainly be utilizing that when we're assessing what construction contractors are doing on the work site.
In each case will be fact specific with the variety of different types of construction work sites. It will depend on the specific individual facts on that inspection.
And that's an important note, Tim, that the fact patterns for each visit that an OSHA compliance officer makes are going to be different. And so it's important that we evaluate the actions of each employer and their responsibilities in regard to our multi-employer policy each and every time.
All right, great, thank you. I think this one I'll throw towards Christina. We have, the question is, to what extent do you see double masking being utilized? And another question that just came in through the chat was about double masking as well. And it says it's recommended that the secondary cloth mask to be filtering, or does that negate the purpose of the first layer being a medical mask? Thank you. So basically, I don't know if Scott wanted to jump in on this too, but Christina, if you wanted to give your thoughts on, what we're hearing from the field as far as double masking goes.
Yeah, I think CDC's guidelines about how to effectively double mask are super helpful. I haven't heard a lot of specific questions coming in from the field. I think many of the questions that I've heard so far are about discouraging just the single fabric layer gaiters and getting people to go to like at least the cloth face covering with 2 or more layers, or a surgical mask. But I think the really critical thing there is having the surgical mask be the bottom layer and then having that cloth mask or face covering over it to hold it more snugly in place.
Hey,
Scott,
Chris, yeah, this is Scott Earnest. The other thing I would add is that when you're looking at the efficiency of a filter media or a cloth media, it gets into the thickness that's there. And the thicker the material, that's going to increase the collection efficiency of it. So if you add a second layer or even a third layer, that improves the collection efficiency. And so that's the basis of a lot of the guidance with double masking, as well as what Christina had said previously about gaiters, and where if you have a single layer versus a multi-layer of material, it's gonna improve the performance.
Great. So I wanted to just jump back to Christina for the age-old question we get about safety glasses fogging up when using masks. If there's any options or any suggestions on how to help with that?
Yeah, absolutely. Adding or using a mask that has a flexible nose piece that you can snug down over the bridge of your nose to create a little bit better of a seal. If you are wearing an N95 respirator, OSHA has a great how-to video on how to put one on so that it fits securely onto the face. And that also helps cut down on the fogging with safety glasses, because if you're wearing a respirator correctly, you should have very minimal escapage air around the edges that would go up into the safety goggles. I'm not sure if Scott and Tim maybe also have some thoughts about how to improve that strategy as well.
Well, I agree. I think that, having the nose piece on there certainly helps just from my own practical use over the past year myself. In addition, I wear glasses. And so constantly, without having that flexible nose piece on, my glasses will continue to fog up. I've noticed that with cloth face covering. So there's some interesting ways to add a flexible band of metal into a cloth face piece that actually works, that I've seen, where people are making cloth face coverings with a band on it that's helpful as well. But I definitely get when I don't have that band on, my glasses do fog up. And I've treated them with stuff that you can put on it that will help keep the fogging down, but it invariably comes back with time.
Right. I've heard of, using soap to wash the glasses and then rinsing it off helps reduce fogging, as well as things like commercial products like Rain-X that are intended to reduce fogging and repel water are reportedly help reduce fogging. So that also is a question that was brought up in real time in the questioning. So I'm going to keep it on you, Scott. As far as, have you been getting a lot of feedback from craftsmen and women on the job, construction workers, as far as the use of masks and face covering, and what kind of things are you hearing?
Yeah, we, through the ACOSH, when the pandemic first hit last year, we were looking for ways that construction workers were protecting the type of gear that construction workers were utilizing. And we've got some really good information on that. A lot of it had to center around, and again, this started in the winter stages, but as it got into the summer stages, there was a lot of concern about heat and the heat generated in a hot environment, and then wearing them all day. We got a considerable amount of comments about the heat and about wearing a face covering or a surgical mask or other type of respiratory protection over the day. But it's pretty much been consistent in that sense. But the protective measures have been covered numerous times through these webinars and through some of ours as well. And I think the construction industry has done very well. I want to commend the construction industry for responding very well to, as a whole, not everyone, but as a whole, very well to protecting workers. And certainly commend CPWR and NIOSH for their extensive work on going over protective gear with employees and employers and other stakeholder groups. But that's the limit of our involvement in regards to that. But we did get numerous comments from stakeholders about the protective gear and its effects, especially with the heat.
Great. And just to kind of along that same vein, CPWR and NIOSH and periodically our colleagues from OSHA have been doing these webinars and developing resources from day one. And CPWR stood up a clearinghouse to try to collect all of the information we could find from localities, states, guidance, implementation of guidance, examples from the field, and also an exposure control planning tool to help employers develop a written exposure control plan for COVID-19. And it's all accessible from our clearinghouse. Jessica just posted another link to the clearinghouse. And I'm trying to, at the same time, respond to the question is like, what are we doing to help companies? And it's really trying to bring these guidelines to your attention. The exposure control planning tool helps you operationalize the guidelines exactly for the hazards that your workers are facing on your job sites. So,
hey, Chris, this is Scott Earnest. If I could add to what you said, the other thing is we have a COVID-19 work group that we set up on our construction sector council, and they have regular meetings. It's being chaired by a representative from the laborers, Travis Parsons, as well as somebody with Liberty Mutual, and we've gotten a lot of great stakeholder input through the council and through the work group that's been fed into the development of a lot of this guidance. We just put up checklists about a month or so ago, and a lot of that material that was in those checklists came from input from the stakeholders on the work group, as well as, we brought on a bunch of professors from all over the country with a tremendous amount of expertise in these areas to assist and provide input to this.
Right, Scott, and just to kind of follow up, I'm looking at another question that came in before the webinar, as well as a bunch we're not going to get to. One was related to ventilation when an HVAC system is not operational yet on a construction site, or is just not there on a construction site or in an enclosed space, and that's something that the NIOSH Construction Sector Council work group tackled, and along with the professors that Scott Earnest mentioned, and we've developed some guidelines based on the expert opinion of that group on what to do on job sites that do not have a functioning HVAC system to improve the ventilation, and therefore, we hope, reduce the risk of this airborne hazard. So that was another question that came in. I'm going to flip it back. There's questions that we always get about, the body burden of wearing face masks, and isn't that, isn't it detrimental to health? Is the specific question. And I was going to throw that at Christina, if you'd care to answer that. Isn't the excessive use of face masks being worn for an extensive period of time detrimental to health? Is the question.
Yeah, I don't think we've seen any strong evidence about that, particularly in the last year, as we've come to see cloth face coverings and masks being a first line of personal defense against SARS-CoV-2 and transmitting that to others. Obviously, the material that the mask is made out of is really critical as well. There are some fabrics, that are just not as breathable. I've seen some face coverings that are, marketed that are like vinyl or fashion masks that are covered in glitter and sequins, and I can imagine that that's probably challenging to breathe through. But as long as you're sticking to the CDC recommended information for the face coverings and masks that you're choosing, there should not be any prolonged health side effects. I know it's a concern for some folks who have asthma. Wearing a surgical mask shouldn't impinge their ability to breathe, even over long periods of time. For folks who are, exerting themselves, either through work or exercise, obviously that might be a little bit more challenging. And to that, I would point to OSHA's guidance about wearing face coverings and masks in hot and humid environments, because that does have some tips about doing physical activity while wearing a mask.
Right. And I'm going to keep it on you, Christina. We're getting some questions in the real time that relate to donning and doffing respirators to minimize cross-contamination. And is there any guidance that OSHA has on that? This would obviously be pre-pandemic, because we always think about how to properly don and doff. But is there anything that perhaps you can point to that would help employers understand, the best ways to don and doff?
Yeah, absolutely. We definitely have some of those resources. They're available on our OSHA.gov/coronavirus page. As I mentioned earlier, we are in the process of updating a lot of that information to align with our new guidance. But I think there are I can find those exact links and send them your way to share with folks afterwards. But there is also a really great CDC page that talks about even appropriate donning and doffing for wearing cloth face coverings as well. It doesn't necessarily have to be a respirator, but you should still probably follow the same kind of procedures, taking it off by the ear loops rather than touching the front part of the mask as well. and, washing your hands well afterwards, before and after putting on your mask as well.
Right. And, this issue of, in particular, donning and doffing respirators has been around for a long time based on other hazards. So we'll also, and I can flag for Jessica to dig up some other resources that, deal with how to put on and take off actual respirators in light of, particulate hazards that might be helpful and send out in the follow-up email to this. We do have a few more questions I want to get to, but before we do that, I was going to ask Tim and Scott Ketcham if they wanted to say a few remarks, and then we'll go back if we have time and hit a couple more of the questions that have come in recently.
You want me to take that, Scott? Well, I'll actually talk about some non-traditional workplace hazards that are also affiliated with the COVID-19 pandemic. Now, OSHA might not be the first federal agency you think of when you hear about non-traditional workplace conditions. And we're talking about post-traumatic stress disorder, drug use, suicide, and other mental health issues. But our mission is to prevent work-related injuries, illnesses, and deaths. Now, since 2015, 1,406 deaths by suicide and 1,272 unintentional overdose deaths have occurred in the workplace. Now, it's a complicated issue because of the overlapping work and non-work factors that are involved with it. But OSHA issued a press release early into the pandemic in reminding employers that they need to plan for potential hazards related to the coronavirus as we return to work and open up the businesses. We also have to keep in mind that those hazards stemming from routine work processes are still there. So in the release, it reminded us that employers should be aware that the pandemic might increase stress, fatigue, distractions, and employers should consider these factors in planning for their employees to come back to work. This additional stress can come in the form of fear of job loss, fear of the virus, anxiety dealing with child and elder care, depression, isolation, the non-traditional loss, mourning of a loss of a loved one during this time, are all additional stressors workers are carrying into the workplace. But the original focus for workplace hazards, such as the falls, struck by, caught in between, electrical hazards, will still be there and also need to be addressed. And that's what Mandy was mentioning when she opened up. Now, these non-traditional conditions are both a serious public and occupational health problem that have lasting harmful effects on individuals, families, workplaces, and the community in general. So, OSHA recognizes the value that our outreach network provides and how it adds to worker safety by amplifying our voice, specifically in the construction industry. So thank you for that amplification into this network here on the webinar. When you share health and safety resources, be aware that mental health is a part of health and safety, and safety might be compromised if workers are distracted when operating equipment, working at heights, or any other situation where focusing on the task is crucial. Now, the agency is looking at ways to productively work with other agencies and stakeholders to help shed light on this problem. We're looking for ways to help prevent these terrible incidents from happening. Now, OSHA created a web page with free and confidential resources to help employers and workers identify warning signs and know who and how to call for help. The last thing anyone wants to ask themselves after the fact is, was there something I could have done about the drug overdose, about the death by suicide? Please visit the Suicide Prevention Resource page on the OSHA.gov webpage and let us know if there are any specific ways to best get this message out to the construction industry. In addition, the National Safety Council has the Safe Actions for Employee Returns, SAFER, which is a multifaceted, comprehensive effort aimed at helping employers prioritize safety as they return employees to the traditional work environments. CPWR at cpwr.com has published a mental health and addiction website with handouts, planning tools, and training programs. NIOSH at cdc.gov has multiple resources on total worker health, addressing issues such as traumatic incident stress, substance use disorder, suicide, and much more. So these are not new issues, but issues that have been highlighted by the pandemic. So I'll close with that and turn it back to either Chris or Scott. So thank you.
And Scott Ketcham?
Yeah, just real quick, I just wanted to thank everyone for coming to this today. And I just wanted to, a quick comment about the upcoming National Stand Down to Prevent Struck By Incidents on April 26th. Please join us on that. And we're looking forward to having a dynamic week that week. And then the following week is the Fall Stand Down. And so those are both very cause-worthy events. And we're looking forward to great participation, and I hope you can join us on that. I did want to say, as just a final comment from the Directorate of Construction here, that together we can make a difference. That's you and I, us, all of us. We can prevent injuries and we can save lives. Let's do all that we can to send every worker home safe and healthy at the end of each and every day. And I thank you for giving us the time today to talk with you about COVID and these other hazards that we're dealing with in the workplace. And we look forward to working together with strategies to make the workplace safer. Thank you.
All right. Thanks, Scott. Thanks, Tim. I wanted to make sure you guys had a chance to share those three items about what is really important and coming up. But I'm seeing a lot of information, a lot of questions that we can't get to because I want to wrap this up in just a minute. However, there was a question on President Biden's enactment of the Defense Production Act. And I just wanted to ask Christina if this is something that was in your wheelhouse at OSHA, or is it outside of your wheelhouse? Because I don't want to put you on the spot if it's not your area of expertise.
Yeah, that's definitely outside of my wheelhouse.
Okay. And the question was related to President Biden's enactment of the Defense Production Act, and it hasn't been used to up the production of N95s. I don't specifically know the real answer to that question myself. However, I did want to direct folks to our December webinar on COVID, where we had the head of the NIOSH National Protective, Scott Earnest, NPPPL,
National Personal Protective Technology Laboratory.
Thank you, Scott. And we focused on respirators at that time, and there was information shared in that webinar about the availability of N95s at that time. They're not maybe available through the traditional sources, but there are N95s available for purchase to the construction industry and to all industries. You just have to look a little harder for them. And a lot of other information on respiratory protection in the December webinar. And we've had a lot of questions on vaccinations that we're not addressing in this webinar. Last month, the CPWR and NIOSH webinar focused on ventilation and vaccinations. So there was a lot of great information shared. And we do have resources in our clearinghouse on vaccinations. And next month, we're also doing a webinar with a new team that's been stood up at NIOSH CDC about vaccinations. So stay tuned. We will get to those questions. And with that, I wanted to thank our presenter. Well, I actually want to thank Jessica, Liz, and other people who posted amazing resources in the chat. If you have a chance, try to copy and paste the chat for all the different resources, from guidance from 3M that's available on their public website on donning and doffing, to resources throughout CDC, CPWR, and OSHA on all of the topics that we were discussing in real time. So with that, I wanted to thank our presenters today, Christina, Tim, Scott, and Mandy, who's gone now, and thank Jessica for hosting, and wrap this one up. Thank you, everybody.